So imagine driving a high-performance car, but having no idea how the engine works. When the check engine light comes on, you slap a piece of tape over it and keep driving. Sounds crazy, right? Yet this is exactly how millions of men approach their sexual health. Ignoring the warning signs and reaching out for a quick fix without understanding what's really breaking down under the hood. So today we are joined by a very special guest, Dr. Arthur L. Burnett, the second who is globally recognized urologist, educator, and researcher at Johns Hopkins University, where he serves as the Patrick C. Walsh Professor of Urology and Director of the Male Consultation Clinic. A barrier-breaking leader with over 40 years at Johns Hopkins, he is the first Black person to achieve multiple historic milestones in urology, including serving as Professor of Urology at Johns Hopkins, President of the Sexual Medicine Society of North America, and a board member of the American Urological Association. Dr. Burnett has performed thousands of prostate and urologic surgeries, pioneering minimally invasive nerve-sparing techniques, and his groundbreaking research on erectile function helped make oral therapies like Viagra possible. He's a passionate champion of men's health. Dr. Burnett has published more than 500 scientific articles and authored 3 books, including the Manhood Rx, Every Man's Guide to Improving Sexual Health and Overall Wellness, which distills decades of clinic insight into accessible advice for men. As founder of Uro Missions Works, a nonprofit providing urologic care to underserved communities worldwide, his work has earned numerous honors, including the American Urological Association Distinguished Contribution Award. He's also a distinguished military graduate of Princeton University and U.S. Army veteran, and it is Veterans Day tomorrow, so that's awesome. He served as Major Dr. Burnett and continues to shape the future of men's health through his groundbreaking research, compassionate patient care, and service to community and country. Today, we're going to pull back the hood, the curtain on the health crisis hiding in plain sight, erectile dysfunction. It isn't just an awkward bedroom problem, it's your body's emergency alert system telling you that something is far more serious is going wrong. Dr. Burnett will reveal why ED is often the first sign of heart disease, how our lifestyle choices are systematically destroying male sexual function, and why the little blue pill, while helpful, is just a Band-Aid covering up potential life-threatening conditions. Whether you're dealing with these issues now, worried about your future, or simply want to understand how your body actually works, then the title of this is Beyond the Little Blue Pill. So this is Keith Dent from the Black Men Speak podcast. Dr. Burnett, how are you doing today?
I'm doing just great, Keith. Wonderful to connect with you.
Great. First, happy Veterans Day.
Happy Veterans Day to you, sir.
Yeah, thank you. So, what inspired you to write the Manhood Rx, and what do you hope readers will take from it?
Well, what inspired me to write this book was that I felt that there was a need. There's a need out there to bring credible information about being a man. And it perhaps best comes from somebody who has the qualifications to do that. Yes, there's a lot of information out there in the form of various media content and literature, perhaps some things that are incorrect information, misdirection. But even that is supposed to be important, and correct information may come from those who are not truly those who know the best about the aspects of men's health. And as you described early on, I was fortunate enough to go off to medical school. The military gave me some footing with that and helped finance going to school. I gave them some military time. They went on to medical school, trained as a surgeon and then a urologist. And a urologist is the specialist who focuses a great deal into men's health, the urinary system, the pelvic area, and so forth. And so I really understand the biology of functions in the pelvis. I understand the impact of conditions that as a clinician, a surgeon, managing men's health issues in that part of the body, the public area, that perhaps I could be the one who could step up here and play a role. Now, this is not something new. I've been doing these sort of things in my practice here at Johns Hopkins. I've been there 40 years. And so I'm very much involved in men's health issues for many, many years on various levels, from the science of it to advocacy to health policy to all kinds of things. So I just felt that I would be able to bring the necessary credentials, if you will, the background to really to speak to issues and help men really know what's very important about maintaining their best health and being the best man they can be. So I'm hopeful that readers take away from it just some basic sound principles, some guidance, and feel that they're getting some correct information.
Mm. Yeah, and you say correct information, which is key. What are some of the misconceptions that are out there that most men are receiving when it comes to their sexual health?
Good point. I mean, there are misconceptions for many men. I think, unfortunately, we've kind of had decades of concepts about how a person should be the Marlboro man, you know, the tough guy who doesn't admit that he's got any emotions, guy who smokes cigarettes and stands out there and acts like he's a tough guy, you know, all that kind of stuff sounds great. And of course, it's promoted in so many aspects of our media, from TV commercials all the way up to movies that kind of convey that kind of message, and that's all well and good. I mean, men should be men. Men should be strong and healthy and that kind of thing. Be kind of physically tough and so forth, but at the same time, not to the detriment of their health. And There's misconceptions about what it is to be a man in terms of sexual prowess, in terms of how you should go about aspects of your life, even living right and eating right and so forth. So there's so many misconceptions about all of these sorts of things that I think that needs to be addressed.
Okay. Yeah, absolutely. And so we automatically just think, when we think erectile dysfunction, or ED for short, that it's just strictly a bedroom issue. But in your book, you kind of state otherwise, that it can be an early warning sign for other health conditions. So if that is true, what are some of those conditions that ED can help, I guess, signal as the warning signs?
Well, absolutely. I mean, on one level, we think about having erections and being sexual as just being a recreational thing, perhaps something that suggests that it's just not a critical aspect of one's physical and mental health, even necessarily, but
Mm,
rather it is the contrary. And I think we've evolved greatly in our field from going back a few decades. There was, the sense back in the era of Masters and Johnson. If your audience has heard those kinds of terms, where it was thought back in the 70s or whatnot, going back 40, 50 years now, that erections was all a matter of mental health problems, mind problems, interpersonal relationship difficulties, things of that sort. And we did not understand the science of erections. We understand erections really is a matter of functions in the body that have to do with your hormone health, your metabolic health, blood flow, nerve tissue, all this coming together. And believe it or not, our men's organs, the penis, is an indicator of how healthy you are. To get erections uh, is a reflection of your general health. And so, with that understanding, we've really learned that there are conditions out there, conditions that include cardiovascular disease, hypertension, peripheral vascular disease, these kinds of vascular blood flow problems in the body, the vascular system we talk about, that are very common. Heart disease is out there. And so we know that that's related to your erections, diabetes. We're dealing with an obesity epidemic in our country right now. All of these different kinds of high level in terms of prevalence conditions do correlate with how your erections are behaving. And so it's very clear that those who have good quality erections have morning time erections many times, erections with sexual stimulation. It generally correlates with a generally good health. If you start to have problems with your erections, then it may actually be an indicator, almost a harbinger, that things are not quite right with your health. And maybe if you're a man here, maybe you need to go and see your primary care doctor, go get a health checkup, get your cardiovascular system checked out, get your hormone system checked out, make sure you don't have some latent diabetes or metabolic syndrome conditions. And so you're asking how well can having your penile erections occur relate to perhaps an association with other health conditions? That is exactly it. Believe it or not, how well your erections perform, it should be something that individuals should start to recognize that that's not good, and something may be going on with your general health in different ways that deserve a checkup.
Okay. That's pretty heavy stuff. And since I guess like diabetes, hypertension tend to flow more into, well, let me ask you it this way. Is that something where those kind of illnesses affect more the Black community? So is there a correlation there that you see like in your work where ED can affect more of the populations of color?
Well, you touch on something that is also very sensitive to me as a Black surgeon. Um, and certainly being an advocate for those in our community in the Black society. I do feel a very significant role here to help bring attention, because you're absolutely right. We look at statistics out there, and statistics for all kinds of diseases, from cardiovascular diseases, heart diseases, diabetes, and even cancers, disproportionately affect Black men. And just an example, I'm sure we may get into a little further down the road about prostate issues. Prostate cancer, for example, and occurs with at least a 60% higher incidence in Black men, and has a 2.5-fold higher mortality rate that claim men's lives when you're Black. And there's various factors associated with that, but even other conditions, diabetes, high blood pressure, cardiovascular disease, all higher in the Black community. And so I think we need to be even more attentive to that. And there may be various factors, which we can talk about, that have to do with why that is so. But just in terms of just my concern that we bring attention to this, is that yes, we need to recognize this and not just say, okay, I don't need my health checkup. Even if your erections are changing, they can be an early warning sign. But even if they're not changing, I think men in general, my overall message is, men, get your best health. So get your checkup, because these diseases and conditions affect us disproportionately.
Okay. Yes. And so then another kind of thing, which kind of often goes kind of unchecked, is really the psychological aspects of our sexual health. So how do patients kind of navigate the mental, kind of emotional components of ED? And what are some of the, I guess, markers that you use to kind of gauge if patients are having more psychological or emotional issues?
Well, I think that certainly the sexual function is a mind and body experience. Um, and performing in the bedroom and with a partner, because oftentimes sexual function is a couple's condition, a couple's scenario here, does then suggest that there's more to it than just what's going on between the legs there. It may be a matter here of how you're able to interact with a partner, how you're able to have a satisfactory sexual experience, and all of that may indeed be a matter how you interrelate with the partner, how you have that relationship, how you have kind of a mental health aspect. And, psychological also seems to have that kind of a negative connotation. So I don't want to say that, everybody's, prone to have disorders of any sort here psychologically, but just in terms of just how men can be anxious, they can have depression, they may have trouble with sexual function. All of that intertwines with the biology of how erections occur. And so recognizing that relationship, that component of how we perform sexually is important. And that this also gets to the emotional health of men. Rather than being macho and denying all of that, we should be more upfront about it and then addressing it. Now, does everybody need to see a psychosexual therapist? No. But I think that the way we go about it is to at least recognize the reality of how these associations are there, and welcome the discussion. Not look at a man and say, "Well, you're too emotional," and then just suppress all of that. That's just not right. We need to kind of put it on the table and try to understand that mental health aspect in terms of sexual ability and performance.
Right. Okay. But it seems nowadays things actually have become easier to try to not necessarily go at the problem. So case in point, I mean, you could pretty much, you don't even have to see a doctor nowadays if you want to get um, uh, medication for ED. You could just go online, have I guess, an online consultation with a doctor, and you're good. So, what are your thoughts on kind of the ED, landscape when it comes to medications? And then are men kind of relying too much on that as opposed to going to see someone like you and really get a true diagnosis?
Well, yeah, you're hitting, on the central aspect of our talk today entirely, and perhaps addressing or at least bringing attention to exactly why this discussion is so important, because I think that it is timely that we have these kind of conversations in this world today, where things are so accessible just to try and bypass the reality of certain situations, look for quick fixes, create misdirection about performance and so forth. Whereas there's so many layers beneath that really should be addressed. We just talked about men getting proper health checkups. In addition to that, when they have sexual dysfunction. Not only that, we need to make sure we address the proper sense of one's sense of well-being, and not just think there's a quick fix. The quick fixes all the time don't solve the problem. It may allow a man to get an erection, but if he's still having some mental health conflict, some interpersonal relationship difficulties, those things are not being addressed. If he's still having a lot of depression and anxiety and emotional upset, just grabbing a pill, off the internet, that does not address those things. So my message in communicating today is largely to say, listen, let's recognize all of this. Let's try to get the right information. If you're thinking you need some help, seek the right person. Let's not look for just some quick fix from an online source, and perhaps deny other aspects of your best health.
Okay. And you've been doing this a long time. So in your, I guess, traveling around or just speaking, I'm sure you've spoken about this topic many times. Why is there still such a stigma to talk about these things? Because, as you know, on the flip side, for women, perimenopause is something that's it's kind of similar in a way where it was something that couldn't really be talked about, but now it's, I guess, gaining a little bit more prominence. It's being more put out there in the open that this occurs. How come on a parallel, we still can't talk about it?
Well, I think unfortunately, get to your point here that why is there still stigma? Why can't we talk about it? Why are there still challenges? And I think unfortunately, very much unfortunately, our modern world has almost championed the Marlboro Man more and more. And we should be saying, okay, yes, it's good to be physically strong and have a certain sense of maleness in that regard. But at the same time, I think the messaging is not there entirely. We see a lot of unfortunate messaging surrounding pornography. We see our society change where there's less connection between individuals because we all can pick up our phone and just feel that we don't need to talk anymore. We do not need to share
Mm,
our emotions and have a discussion. We just try to solve things. Young people perhaps are not even dating as much as they should in a real way. They and learning from each other and trying to understand who we are as human beings and build true relationships. So I think we're having so many societal factors right now that are occurring that I think are truly worsening the scenario, worsening the situation, and creating a stigma that men just don't need to have conversations. That they should be performing like any kind of pornography star, that they can continue to be the macho man, and it's just an unfortunate situation, I think, where we have to recognize that we perhaps are undermining our young men particularly as time goes on. We need better sense of what true role models of manhood are all about to
Mm,
maintain the best society and maintain each individual's own health. So you ask what's
right.
wrong? What's wrong is I think there is stigma, maybe on the male side, and there may be aspects on the female side as well. But on the male side, that I think unfortunately is not getting the proper attention and direction that it needs.
Okay. And so let's just say I'm a patient and I come in and it's clear that I have anxiety coming in. Um, what advice do you kind of give patients that are just embarrassed or just are really anxious about coming in to really talk about this issue?
Yeah, so a man coming in the door,
Yes.
I try to first
Mhm.
just inform him that you're not alone, and you're
Mhm.
no less of a man to have these concerns. The reality is what you think you're hearing out there in the broader community, from a variety of media sources and elsewhere. That's not the true man, and don't think that somehow you're just a guy who's having this problem alone, and everybody else is performing at the highest level. That's just not true. So I try to reorient their thought process right from the outset. At the same time, I work with that gentleman and convey no judgment. Try to let him know that we're here to help, that we want to hear what are his concerns, that maybe pulling back the layers, we really get to some issues that have been really there, and we just have to try and understand what all these issues are. And it may be physical things, it may be mental health things, it may be things at home and psychosocial kind of things that are impacting things. Try to figure out where the problems lie. Try to define the sexual disorder in a very clear and non-judgmental way. Is it a matter of erections? Is it is related to ejaculatory disturbances? Is it just emotional and sexual interest issues? And try to, in some respects, even almost bring it back a little bit to the reality of our bodies are our bodies, and there's biological and physical things that are just the realities of health, particularly as we get older or have other health conditions. And we just kind of try to not to medicalize it too much, but just kind of say that that this is not your own doing here. That this is something
Mhm,
that's going
mhm.
on, and let's just go ahead and let's get a handle on it.
And on average, what is the what is the average age where men usually start to see kind of I guess a
Well, not uncommonly, we'll see guys getting into the middle age range where guys start to have more common health conditions of diabetes, cardiovascular disease, heart disease, probably getting in their 50s, let's say. But at the same time, we're seeing increasingly men in their 40s having trouble. And at the same time, my messaging should be appropriate for young men and older men in various areas. The younger men to get their best health, welcome getting regular routine health checkups because things can start to happen even in 20s and 30s. And then older men also, not to dismiss them, say yes. Let's recognize that you want to be as healthy and functional as you can be, even in your 60s, 70s, and 80s, if need be. So, but the common health conditions, again, with such a correlation with sexual dysfunctions and primarily erection problems, occur when these other conditions occur, and we'll start to see that in the middle age range very commonly.
middle age. Okay. Okay. Gotcha. And so then you also mentioned, which is something that probably doesn't um, get as much attention. There's some lifestyle factors like diet, exercise, and even sleep come up frequently. So, what changes should men be making in order to, just from a lifestyle standpoint?
Well, you touch on something here that I think is really another central pillar of our discussion here today, which is, taking ownership for one's own health. And don't just look for a quick fix. And don't look for something that's just an internet pill, even just a doctor to just hand you something and the thing's going to correct everything. Rather, we have to accept that all these different conditions I have spoken about, from diabetes, cardiovascular disease, metabolic syndrome, which has to do with your hormones going awry and gaining weight and be obese, and if you're a cigarette smoker and this and that, changing really how your body is functioning. All these kinds of things, we are doing to ourselves. We
Mm,
unhealthy diets, eating a lot of processed foods, not enough fruits and vegetables, not getting some regular exercise, and even as you say, sleep, which is so important that we can let our bodies rest and get a proper amount of sleep. It may vary from different individuals, but yes, those of us who just have a sense of, oh, we just need to sleep 4 hours and we're great. That I don't think that necessarily is biologically correct. Um, and so, getting at least a good night's sleep, trying to figure out how to get the best sleep. Um, as best you can, giving life circumstances, but turning off the bright lights, going to bed at a set time, not
mm,
doing things that'll keep you up all night, such as heavy exercise or a big meal before bed or things of that sort. All these kinds of things that I think are just wise advice and recommendations to preserve your best health and in turn reduce these other health conditions, adverse health conditions, and improve your sexual health along the way. So again, taking a little more responsibility ourselves and understanding these risk factors is key. Now, at the same time, I realize in our community, not everybody has access to the best conditions. There may be some what we call food deserts, not the best food stores, not the best fruits and vegetables in places, maybe work jobs and that don't allow a regular lifestyle of getting physical activity and even environmental conditions that I think some of our black men and within our community may be exposed to, that may be somewhat problematic in terms of any chemicals or manufacturing situations and things. But we've got to at least recognize these risk factors and try to see what changes we might be able to make in the midst of all these challenges, because really that is the key to achieving your best health. So these lifestyle factors that we may have some control over, we ought to try
mm-hmm,
to understand and possibly pursue if we can.
mm. Okay. And so in your book, The Manhood Rx, which we're talking about today, it
Yeah.
covers testosterone. So can you clarify when testosterone therapy is appropriate and when have you seen it in your, I guess, work or over history where it's over prescribed?
Sure, sure. Well, testosterone is a hot button topic. Again, that's a subject of enormous interest and controversy sometimes. There's kind of the thought that to be a man, you got to have really high testosterone levels. We talk about estrogen in women as a correlate on the female side. But testosterone is a predominant male hormone. There's various metabolites or versions of it that work in different ways in our body. But testosterone is the main hormone, androgen as we call it. And it is associated with so many aspects of our health, our physical strength, our muscle bulk, our bone health. Um, but and even our cognition and our thought processes, having proper hormone levels help our brains work correctly as men. But it also has some impact, as I was saying, on the sexual function side, and there is good scientific support for this. That it has a role here in how well a man has sexual functioning, sexual interest, and sexual libido primarily. Okay, but it may also fine tune erections and have some role in some of that, and even some of the other aspects of orgasmic function and sexual pleasure functions and things of that sort. So having a well-tuned testosterone level is something worth understanding, because it has so many roles in making sure aspects of our body are working well, including our sexual functioning. So it has a role here. Its predominant role, though, just to say it again, is more sexual interest and sexual desire. We say libido, sexual libido, sexual interest.
Mhm.
It may not be the cure all and be all for everything. So if a man just says, "I just want my testosterone checked and I need it to be higher and my erection is going to work," well, that's just not true. If you have diabetes and heart disease and other risk factors to make your erections be less than the best, those things still need that attention of getting your best health checkup, get your diabetes under control, get your cardiovascular system tuned up. Testosterone is not going to trump that. It's not going to somehow uh, overshadow those issues and need that attention alone, and that's going to correct everything. That's just not true. So we think about testosterone more a matter of if a man's coming in saying my libido's changed, and we try to distinguish that from erections. Now, if a person's erections aren't working, yeah, he may say that that's caused me some depression, therefore I'm not that excited sexually. But but if really the situation is my primary factor is I just don't have sexual interest anymore, then that suggests to us there may be a testosterone deficiency issue. That man
Mm,
may say, I'm getting erections. I wake up in the morning with erections. I can get erections, but I'm just not interested in sexual activity. Well, it's possible his hormones are changing, and that's testosterone there. So, yes, as part of our sexual workup, yes, indeed, we do screen with testosterone many times. Find that a man may have a low level, it'd be testosterone deficient, as we say, and that may warrant some testosterone intervention. But first, we got to check a level. Okay, we don't just
mhm.
hand it out,
Just hand it
in
out,
a
right?
haphazard way. That's just not so, because handing out extra testosterone has some potential adverse effects. And believe it or not, too much testosterone can make you become infertile. It can change your body's ability to create sperm and create the abilities to cause reproductive function. So it can actually, in
Mm,
excessive amounts, be adverse. Uh, there have been some other thoughts that it may cause other kinds of conditions like prostate cancer or heart disease. That's really not been shown to be true. They may have some associations when these conditions are already occurring, that we have to be careful about in giving testosterone. So I just want your audience to hear that testosterone itself does not cause these other conditions, but it should be done here in a very thoughtful way, addressing the problem, understanding, yes, that it has more to do with libido than just erections, that we always should be checking for blood levels to confirm it first. And then, if right, get a person on it, monitor how well he's responding to it, recheck testosterone levels while you're on it, and then carry on with monitoring while you're on such therapy.
so as a warning for those the pills that they talk about during the, I guess, sports talk shows, you should be very wary about taking those without medical consultation.
Well, indeed. I think unfortunately, erectile dysfunction pills, testosterone supplements, any of these things that or wherever you get them from the gas station to internet sites, just be aware that there may be implications surrounding these therapies. Not only as we talked about earlier in terms of just overlooking, your basic medical health needs and not having that addressed either with health conditions or just maybe the psychosexual side of your sexual functioning that needs some attention. But notwithstanding that, they may have adversity. And so we need to be careful about using some of these medications and hopefully obtain them through an authority, and then understand what their impact is and what the possible side effects could be in terms of being on these therapies.
Okay. So turning to, I guess, prostate issues. So I think in your book, and I'm sure you'll clarify for me, 1 in 8 men will suffer from prostate cancer. Is that correct? And did I get that right?
Well, that's true. So to answer that question, it is 1 in 8 in general, but about 1 in 6 Black men.
1 in 6 Black men. Oh, wow. Okay.
And I should add to that statistic that if you have a primary generational family member, a brother, a father who's had prostate cancer, then they may even go to 1 in 4 risk. So,
Mm,
in terms of a genetic component that may be related to prostate cancer, and we're still working out the biology of prostate cancer. We do know
mhm.
that there are a variety of factors that may have to do with prostate cancer. It's not all genetics, but it's not no genetics either. There is a proportion of genetics that is related to prostate cancer, and so you can see these are statistics that suggest if you're a Black man and you have a first degree relative, you may have as much as a 1 in 4 chance you're going to get prostate cancer.
Oh, okay. And so two things on that. When, just so everyone, especially for people that have not been to the doctor lately, what age should you start checking for prostate cancer? And then how do the prostate treatments impact sexual function? And what can men do to minimize these effects?
Right. So a lot to say with an answer on that, but I'll start with
Yeah.
the workup, and I'll get to the implications and the considerations for managing prostate cancer treatment complications. But with regard to screening, conventionally, there's been the thought that men only in the 50s or so need to be screened. Maybe 50 to 70. And in fact, the U.S. Preventative Services Task Force about 15 years ago proclaimed that men only between the ages of 55 and 70 even need to get a PSA, a blood test that screens for the health of the prostate. PSA standing for prostate specific antigen, a blood test. So just getting a blood test that can screen for this chemical that's released from the prostate gland, that if it gets outside the normal range, does give us some sense that that might be an association with prostate cancer. And I say might be only because it can be elevated for other reasons too. But if it is elevated, we have to think about the risk for prostate cancer and then carry out further diagnostic tests that may help us know whether prostate cancer really is the explanation for that PSA elevation or not. But know that screening now, I think we're reevaluating these kinds of guidelines. We recognize in the Black community and those with a strong family history that you can't wait to age 55. You need to get a PSA earlier. Some will say 45 with the various society guidelines. Many of us urologists, and particularly those of us who are the Black urologists in this country, who are really trying to carry the torch here to help us Black men, we say at age 40, you may need to go in there and get at least one PSA test. Start it, get one
Mm,
then. If it looks like it's even trending in the high range of normal, well, get it repeated within a year or two. And if it keeps changing a little higher, hey man, don't wait till 55. I've seen too many guys in the early 50s who are Black men who have died from prostate cancer. It's happened. And
mm,
so the reality is, get it earlier. If you're gonna, and so as a Black man, I would say 55 to 70, not good enough. Get in there at least 45 and maybe 40. At least get a screening PSA. If it looks kind of
right.
normal, well, come back in 5 years, fine. But if it looks a little bit on the high range, within the normal range of 0 to 4, and it's like a 2.5 or a 3, I'd be like, okay, young men, it should be kind of like less than 1 in general. Something is kind of giving me a little concern that if that cancer might be developing and that PSA, if it starts to change higher and higher, we use that as one of our primary tests. Now, this gives me the opportunity to speak a little bit about the digital rectal examination, if that's okay with you, Keith, because everybody kind of was fearful, like, oh, nobody's going to touch me down there. I'm not going to have that kind of thing going on with my body. No way, blah, blah, blah. Well,
Mm,
I hear you, gentlemen. You are listening to this podcast. And my answer to that is I hear you. And yes, we all have these kinds of blocks, say, mental blocks or challenges, whatever you want to call it. Saying, that I don't need anybody doing that sort of thing to me. And then someone might argue, well, women get their examinations when they're teenagers. Why aren't fellas getting their periodic checks? That could be that very draconian kind of argument put out there. But know that the PSA test, it really is at least fundamental. Get that done. That probably will tell us 9 times out of 10 whether something's really going on. We still may miss guys though, very small numbers though, if we don't at least just do a gloved finger checking inside the rectal area and checking the prostate for any kind of irregularities or hardness, because there are some rare instances where the PSA doesn't change much, but prostate cancer is developing. So if you want to be thorough, get the PSA blood test along with the digital rectal examination prostate exam, but at least get the PSA. So that's the screening. That's what I'm telling all Black men to think about.
hmm
Get it done. Once you get in the 50 to 55-year-old age range, you probably need to get it annually, just
Right.
to keep better closer eye on, because that's when the prostate cancer risks start to go up. Okay, and then I always let the guys know, well, when do I stop? Okay, so I've had some guys walk in the door, they're 85, saying, I need to get my PSA. And I always kind of chuckle a little bit, because my thought here with that is there is a situation where as men get older or have other health issues, where their lifespan is not going to be at least 10 years. We should be very thoughtful that we do not want to overdiagnose and overtreat prostate cancer and expose men to potential side effects that would not have had
Oh,
an
okay.
impact in that man's expected lifetime. So I want to make that message very clear. So it's 55 to 70, right? Is 70 stopping, right? Well, if a guy's completely healthy, and he says, my parents lived to be 95, I'm gonna be like, yo, man, you better keep checking it until you have a sense that your lifespan is going to be less than 10 years, because prostate cancer in general moves slowly enough. It's not like a pancreatic cancer or a brain tumor that can do something in a
Oh,
year or two and take your life.
right.
Generally takes a few years. So, so with that said, the guys who are typically older, I do get concerned that we should not be overdiagnosing older guys, exposing them to side effects, where it's not going to bring them any benefit. and really have some side effects that really will change their quality of life in a major way, without any real gain to be achieved with it with that. That's the general thoughts about screening and early detection and taking action. Now, you mentioned in your question, what about the adverse effects, the effects on treating prostate cancer, and that's well known. In fact, that may be part of why reasons, in addition to guys just don't want people touching them down there, that they don't get treated because they're concerned that, yeah, if you get treated with surgery or radiation or even other therapies that are trying to come along, that treatment in that part of the body, with the prostate sitting right deep in the pelvis at the root of the penis, does any treatment there affect the blood vessels, the nerve tissue that governs how erections occur? And the answer is yes, these treatments can have that adverse effect. And radiation too, because I hear too often out there, I don't want surgery, let me get radiation because I know radiation is not going to affect me. Well, that's not true. That is not true.
Mm,
It is not true.
that's not true.
Radiation may
Okay.
not affect, may affect your erections in a delayed manner. Okay, maybe in the first year you don't sense that radiation's changed much, but within 3 to 5 years, more than half the guys who had radiation for prostate cancer, that the radiation deep in the pelvic area does change the blood vessels and nerves, and just slowly over time, their erections will decline. So I think the reality is radiation as well as surgery. Surgery may have a different kind of pattern to it. You get a surgery, a prostatectomy, a radical prostatectomy, we call it, removing the prostate in entirety, done by an expert surgeon who does these surgeries very regularly, and that patient may feel that, yeah, my erections are not there for the first few months, but within a year to two, those who had quality erections to begin with and have a very good quality surgery, and I won't get all the nuances for the audience here, but go speak
Hmm.
to a surgeon if you have this issue and have this discussion. But with a quality surgery and with a little time, within a year or two, the majority of guys who had quality erections will get some erections back that may be good enough just with an oral pill, like these oral pills that are FDA approved, and be functional at a higher rate than radiation will have left them. And so the reality is that there will be some impact, but we need to talk the truth about what the side effects of these treatments will bring, be smart about who should be treated, or what their health is all about, and what factors have to be considered. And if you do get treated and you have erection difficulties, let's not deny the reality of that. Let's step it up. Okay, we do have a variety of treatments in our arsenal that we can bring to a man that will help him regain ability to have erections and be sexually able. So we have treatments out there.
Okay. Okay. So one of the things that we really haven't covered is our partners, because of course it impacts our partners as well. And I guess the shame or not coming forward can have a direct kind of effect on your relationship. So how can partners play a supportive role when dealing with sexual health challenges?
Well, partners are essential in my view. Some may say it's nice to have, but I think that partners play such a role. And partners, whether it's a true spouse, companion, somebody you have a trusted relationship with, all the above, a family member, hallelujah. But even a partner, that's truly a sexual partner, perhaps, can be supportive, and perhaps that it may even build a stronger bond to bring that person into the difficulty and have them be part of understanding the problem and also working toward a solution. So I think that partners for patients who struggle with erectile dysfunction is such an essential thing. I welcome it all the time. I tell patients who come to see me, let's have a discussion. But if you want to come back and you're not with your partner today, we can have another discussion with your partner present, go over all the options for you, figure out what makes the most sense. Again, sexual dysfunction is a couple's problem much of the time, and I think we perhaps need to think about it in that kind of framework. And so with that, having a partner involved to be supportive, some, and you know what, what I'm Keith, I'll share with you is just what I tell all your listeners. When you have any kind of health condition, don't necessarily go it alone.
Hmm.
Sometimes when you go talk to your physician about any health condition, we're all not trained medical doctors out there. We're not going to hear everything correctly. We try to get our best educational piece going on, but sometimes you don't hear everything, and then sometimes you get a supportive partner for any health condition. It's such a valuable thing to do.
Right. And have you found, and so it leads also an interesting question. There may be men out there that don't actually have a partner or a long-term partner. And so how do they attack it that way?
Well, certainly there's real life circumstances. People separate, they don't have partners, but ultimately, if they are going to engage in some sort of sexual activity with another person, well, you're going to have somebody that you're interacting with. Now, maybe they're not on that right emotional level. Maybe they haven't built up to the level of confidence that they truly have a true relationship with that person. These are real world circumstances, no doubt. If they don't have that, well, I think you have to kind of understand that yes, you're coming on your own. Let's try and work with this and try to get you
Hmm.
at least to a certain sexually proficient level, if that's what your goal is. Understanding that you just want to kind of maybe get back in the game and be functional and so forth, and then you'll see where things go. So again, no judgment. We'll support you. We got to work through that. Nobody should be making any kind of judgment along those lines and so forth. I do have to say I have to draw the line that I'm not a matchmaker, but I do.
Okay.
But I am a prostate cancer surgeon and a men's health specialist. So I'll do everything I can to help that man be functional. But the rest of it, I think, hopefully, with my interventions and helping him build his confidence, he'll be able to move forward from there.
So in other words, they shouldn't hide. They should, if they are having some challenges, they should feel comfortable enough to come in and they should get checked and screened and all of those things.
Absolutely, absolutely, and again, making that point clear that don't just go about a life that's not meeting all your objectives, all your goals, being less than the best quality of life you want, not meeting what you consider a satisfying life. Being a man is coming true to yourself and say, okay, let's address these things in a forthright way. Get a credible, reliable, qualified person to get involved with your healthcare.
So just a couple more questions. If you could give a piece of advice just for men in their 20s, 30s, and 40s about protecting their sexual health for the long term, what advice would you give those age groups?
Well, I think that the primary advice I have is um, you're not 20 and 30 and 40 forever. You got to keep getting older. and
Yes,
and
Lord,
yeah,
Lord
but
willing.
yeah, and indeed, I mean, we don't want guys out there thinking that uh, you know, for my mentoring that I do with young men in the city here, I always tell them, you don't want to be a gangster and you don't want to be in the ground. So you got to take care of yourself, do your education, but in terms of general health now and pursuing, a purposeful life in a way, know that your lifestyle impacts and everything we've talked about in terms of diet, exercise, proper sleep, relationships, and so forth, can start in a young age. And you don't have to just suddenly say, I'm having erection difficulties, I'm going to suddenly change everything. And of course, nothing's ever too late. So doing some changes, even when these things are starting to occur, is still valuable and purposeful. But why not be even more preventative and start early in life to do things that are going to be the best things to do to make sure that you have the best of health, physically, mentally, have a quality life and a long life.
Great, fantastic. So this has been a great discussion. Two more things. If someone wanted to get a hold of you, I mean, I'm not sure because I know you're in the system at Johns Hopkins, but if someone's in the general area, how would they go about trying to find you for a consultation?
I think you touched on it right there. And the reality is that we're all connected these days with various media sites. Hopkins, where I'm one of the surgeons here, uh, has their access lines and things of that sort. If somebody wants to come see me, I'm delighted to be of service. I do realize that sometimes getting connected through major institutions is not always easy, but I think they do have accessible ways through the internet just to do that. Uh, I do know that I do have a number of individuals around me too, from my fellows and my nurse practitioners that also help me with management of things. Surgeons like myself do have very busy schedules, no doubt, but we're here to be helpful. And if I can guide your care, please come see me. If I can work within my team to be helpful to you, that's helpful. I think that's useful too. So my best advice is just look us up and come see us.
Right, great. And so last thing, this question is always a surprise. I usually don't let anyone know that I'm going to ask this question because we are always, we're doing so much for our communities, for our families, just to make things a better place. We don't always necessarily think about our role in it. So my question always, as I end, how are you feeling right now as a Black man?
Well, I certainly feel that as a Black man, I've certainly had life challenges, as we all have had. At the same time, I realize that many times we have to accept that I can't blame others for some of the external factors that occur in my life. And rather, I've taken the approach to things where I'm going to proactively have a purposeful life and overcome some life challenges. Being a Black man, we all know what some of these challenges can be. As you mentioned, I'm the first Black full professor in urology here at Johns Hopkins. I've kind of pioneered in many different areas. I've carried the torch going forward, but even in that, I realize that I have some influence, and that I'm a role model of how we can achieve and how we can still do good things, and teach the world that as a Black man, we're not secondary. We're not somebody who's just doing achievements, who are doing it because we happen to be Black. No, we are as smart and able as anybody. We just happen to be Black, and we need to teach the society that we're all as functional, as intellectually able, and able to accomplish things in life as anybody. And if I can help bring that message forward, hopefully that'll enable your audience and others to know that we should all have that kind of attitude about how we should go forward in life.
Right. Dr. Burnett, thank you for being on today. It was very insightful and great to talk with you today, and that you took time out of your day just to speak to not only me, but the people that were listening. It was very informative, and I think our talk today, we may see some changes. People start going to the doctor and getting their health checked.
Well, I hope so. Hope I inspired your audience to do the right thing.
All right. Thank you.
Thank you for having me.
You're welcome.
Black Men Speak was written, produced, and edited by me, Keith Dent. You can find previous episodes wherever you get your favorite podcasts. If this is your first time discovering the show, or you're a Black Men Speak podcast fan, make sure you like and subscribe. We always like to end the show with a quote. And this quote comes from Dr. Martin Luther King Jr. "You know, a lot of people don't love themselves, and they go through life with deep and haunting emotional conflicts. So the length of life means that you must love yourself. And you know what loving yourself also means. It means that you've got to accept yourself." This is Keith Dent from the Black Men Speak podcast. Peace.